Hello po, good morning po sa lahat ng ating mga viewers po from the Division of Davao Oriental Personnel, from the Teaching and Non-Teaching. I am your host po, Mac Eden Novi Cobero from the DRM Division. So before po tayo mag-start for our one-day activity for Division Orientation on understanding on COVID-19 and DepEd required health standard, let's have a prayer and to be followed by the singing of our national anthem.
Magbabaya, ikaw, yang gainan, singpulong ang pagawanan, yang guwag na tagalan, na kanami malago o magpapaya, ikaw yang tigpaningog ng kanami mga piangamuyo dumalang yagabaya di pupuan kami ng kadayada mo. Agang waninindi dadamo bunga ng paguma nagyabati Dawatayanin ka namin kapasaya ka mo. Kalipay namin yung panabi-sabi sa pangalan mo. O magbabaya, ikaw yang yagatubang singka nami mga panawag-tawag sang kadyawan, ikaw yagata. Salamat o kadinayag mga sangawa.
Again po, magandang umaga po sa lahat ng ating mga teaching and non-teaching person who are together with us right now dito sa ating FB Live and YouTube Live po para sa Division Orientation on Understanding on COVID-19 and DepEd Required Health Standard. So before we start our one-day activity, let's all listen to a message to be given to us by the OIC Chief of SGOD, Sir Ernesto H. Cabanes. Mute ka, sir. Sir Ernie. Yes, sir. Kana, sir. Okay na, sir.
Notice.
Gigihang ko anday. Signal diri. Storya daw, sir.
Wala dyan ko yung sounds. Wala ko yung madungog.
Okay, sir.
Madungog na. Ako na? Okay. Especially to our resource speaker, Provincial Medical Center, PSO2 Chief of Hospital, for to discuss on things that we need to do this year 2020. Is the set of 5 that we can really surpass the challenge facing today, pandemic COVID-19, especially in the delivery of education services to our clientele, the students. To our ESDS, Sturgeon U. Pilayo, our SGOD Chief, Ma'am Concepcion K. Wong, to our health and nutrition personnel, Dr. Susan Pineda, Dr. Chesna Blay Toroba, and to our division and field nurses, Division DRR, Mr. Mac Naubi Cobero, to our public schools district supervisors, both in District 1 and District 2, to our secondary and elementary school principals, head teachers and TICs, and everyone participated in this virtual conference. A morning to all of you. Our nowadays is really a big challenge for everyone in the Department of Education because of this pandemic that we are facing nowadays. Because of no face-to-face is allowed, it will lead us to adopt different modalities of teaching, video-based instruction, use of television, online for those who have a good internet connection, offline, wherein modules will be copied in the USB and it will be open in the respective laptop or desktop, and using of printed modules that will be distributed then with the guidance of their parents, guardians, teachers, and volunteers, and other modalities of teaching that can be applied in our own school. Today, we are really privileged to have with us our resource speaker from the Department of Health to discuss with us the health standards that we are going to adopt comes the opening of classes, especially when face-to-face will be allowed by the President Rodrigo Duterte, because vaccine is already available according to him, hopefully by this coming December of this year. So we will be guided through our resource speaker. And to everyone who are with us in this orientation, I would like to welcome you all. And I hope that we can get something because our opening of classes is fast approaching. And through the help of our resource speaker coming from the Department of Health, it will help us to prepare ourselves for this coming this August 24, 2020 during the opening of classes. Mabuhay po tayong lahat and welcome to this orientation. Good morning.
Sir, thank you for that message po. Indeed, it's a very challenging po talaga sa ating lahat, especially right now that we are on two types of modules modules na gagawin natin for our learners, the modular and the online. So again, hanapan po talaga ng internet connection at challenge din po sa ibang mga teachers, especially that we are facing the so-called new normal. Okay, again, Sir Ernesto Cabanes of SGOD or OIC Chief po of SGOD. So before we begin with our activity, I will just discuss some of our house rules for this activity. So later po, we will have a guest speaker from the Provincial Health Office, no? And after po ng discussion po ni Dr. Bersaldo, we will entertain only 5 questions. Okay? But after po the whole presentation, we will have another round of presentation po, which is the orientation on the DepEd required health standards. So after that, we will have an open forum to discuss some of your questions. And again, we have, because of limit of time po, we will again entertain 10 questions. Pero if in case hindi po ma-broadcast yung questions po ninyo during sa activity po natin, we will answer all your queries na pinost po ninyo sa chat box po natin sa Facebook at saka po sa YouTube. Again, we are live in the official page po ng Division of Davao Oriental sa Facebook po, and also in YouTube account po natin. We also have a official YouTube account po sa Division of Davao Oriental. You can check us there po kami. Ongoing po tayo live. And to continue or to begin with our activity, we will have first to discuss the DepEd required health standard. This is in coordination or correlation po or naka-anchored po sa the Department of Health. So we are still in line with the protocols and the guidelines of the Department of Health na inabsorb po ng ating central office hanggang sa regional office, hanggang dito po sa ground, sa division, at saka sa schools po natin at district office. So to give us the presentation, help me welcome the Bureau of Learner Support Services School Health Division Head, Dr. Maria Corazon Dumlao.
So to introduce our next speaker po, let us all welcome Dr. Maria Corazon Dumlao of the School Health Division of DepEd. Good morning po, Doc Dumlao.
Hello, good morning. Good morning sa inyong lahat. Clear na ba ang audio?
Yes po, Doc.
Ayan. Gusto ko pong magpasalamat sa ating mga kapatid sa DRRM for this opportunity again to work with them and present the guidelines on DepEd required health standards. Nandito po yung ating mga school health personnel focal sa lahat ng regions, and I know that ito talagang nung nailabas natin ito, nabasa na at napag-aralan na ng husto, and nung nag-uusap kami ni Director ko kahapon when we were meeting yung mga DepEd CO select directors para tignan din how to operationalize yung ating case management at yung implementation ng details ng AWA, ay nakapag-discuss kami na pag i-present ko ito, hindi siya reading session. I will just present yung mga salient features at ano yung mga mahalagang kailangan nating tandaan. And at the same time, contextualizing itong presentation sa school-based setting po natin. So kung titignan natin, we developed the required health standards as a response to the Department of Health's call for all government agencies to come up with the guidelines using the DOH-AO 2020-0015 or the guidelines on the risk-based public health standards of COVID-19 mitigation as basis. But we know that hindi lang ito yung basis niya. Meron din tayong yung learning continuity plan natin, yung mga civil service issuances, and yung mga presidential directives. And these guidelines are expected to be adopted by the DepEd CO, RO, SDOs, and all public and private elementary and secondary schools and CLCs. So in the absence of specific treatment or a vaccine, non-pharmaceutical interventions form the backbone of the response to COVID-19 outbreak. And NPIs are public health strategies meant to mitigate and suppress the transmission of infectious diseases. So clear ito dun sa administrative order ng DOH, which you can, I know that you also have reviewed this already. Now, ano yung required? Ano ba yung minimum? Tandaan po natin na when we say required or yung minimum, pwede siyang papunta doon sa enhanced or maximum. Kung gusto mo na dagdagan ito, ay pwede siyang dagdagan. Other measures may be instituted guided by the principles of the Department of Health AO as that I have mentioned. But the main principle is that kailangan meron siyang susunding mga principles. Shared accountability, for example. So lahat ng efforts natin shall espouse the government strategic directions of national government enabled or yung mga local government led and people-centered response to the COVID-19 health event. So kailangan, nasabi kanina ni Director ko, na yung isa sa bida ay dapat informed. Informed tayo sa mga pagbabago kasi kung ano man yung isinulat natin dito sa health standards, kailangan din na kung ito ay evidence-based, it will also affect the decision making. So pwedeng mabago yung ating mga decision. Napakaganda ng discussions kanina natin sa testing na hindi na ang evidence na may evidence na dapat hindi tayo talaga going into indiscriminate testing. And meron tayong sinusunod na mga priorities kung sakasakaling meron man tayo sa Department of Education. Ano yung mga priorities mo? Hindi yung mass testing ka lang. So meron din tayong mga guidelines ng testing. So we have the socio-economic equity and rights-based approach. So titignan din natin yung kapakanan ng mga vulnerable groups. So kailangan natin silang bigyan ng additional social safety net protocols and protections. Policy design should always choose the least restrictive alternative that achieve its goals, yung madali siyang maipatupad. In the event of any conflict of rules and guidelines, the interpretation shall ensure the protection of human rights. As such, syempre mangingibabaw pa rin yung safety, needs, and well-being of the individual, and this shall prevail. So, nakalagay dun sa guidelines natin kung ano yung role ng iba-ibang offices. Hindi rin po ito in isolation with the structure and functions ng Department of Education. So sa CO, region, division, and school level, nako-contextualize pa rin yung ating mga gagawin. Now, let's look at yung required health standards framework. So mahalaga na maintindihan natin ano ba yung objectives ng ano yung for COVID-19 mitigation objectives. So kanina na-discuss na rin yung tungkol sa paano mo increase yung physical and mental resilience natin, reducing transmission, reduce contact, reduce duration of infection. And when we will be discussing itong apat na ito, kailangan natin siyang na-translate sa Department of Education into specific measures or interventions for schools and offices. Let's just have a quick examples no increasing yung physical and mental resilience. 'Di ba ang pinag-uusapan natin yung mga kailangan na support natin sa mga learners like yung support natin for feeding program, yung kanilang health assessment, health interventions, yung support natin for health advocacy, yung mental health and psychosocial support na hinahandle ng ating DRR. So nagkaroon na tayo ng separate webinar for this, so we won't discuss this in details. Meron din tayong mga objectives to reduce yung ating transmission. So if you reduce transmission, syempre nandiyan yung mga information education campaign ng proper hand washing, yung respiratory etiquette, yung paghiwalay natin sa mga symptomatic individuals. So kung titingnan natin, nandito yung mga minention kanina ni Dr. Ho na mga behavioral interventions natin. So yung kung i-connect natin ito sa programa, yung washing schools natin, yung ating preventive alert system, nakaka-enhance dito sa objective ng reducing transmission at saka yung pangatlo, yung reduce contact. So kung reduce contact, syempre kasama na rin na naman yung strict physical distancing, at least 1 meter apart in all common areas. At least yun. So pwedeng 2 meters, 3 meters, but basta at least 1 meter apart. And then yung restrictions natin ng travel at saka yung mga yung restrictions natin for physical gatherings and other activities na kinakailangan nating i-monitor din at i-restrict. So, pumapasok dito yung mga online platforms natin for meetings, training, and conferences. And this should be maximized to reduce contact. We also have the reduction ng duration of infection. So, ano yung mga examples nito? Mga early detection and isolation of symptomatic individuals. So, kung titignan mo, meron kang gagawin sa school, meron kang gagawin sa CLCs and regions and division offices. Nandito rin yung preventive alert system natin at saka yung establishment ng ating mga clinic. So, tignan natin sa guidelines. It's clear that offices shall ensure the establishment or setting up or refurbishment of their own clinics for health assessment, provision of appropriate interventions, pagbibigay ng first aid or treatment, and proper management of symptoms ng mga learners, teachers, and personnel natin, at saka sa visitors din. Clinic shall also ensure the provision of referral services. Alam niyo po, yung ating mga health personnel, nag-a-advocate na noon pa na kailangan yung mga schools, meron siyang clinic or health corner. Pero pagdating po kasi sa prioritization, lalo na sa mga areas, yung mga classroom areas, nagiging panghuli yung establishment ng clinic. Pero ngayon, sa mga nangyayari sa atin dito sa pandemic, talagang priority siyang i-set up. Kasi sino ba ang pwedeng mag-provide ng appropriate intervention kung wala man yung ating mga health personnel? We are now in the direction of training our clinic teachers para makapag-respond. Nandun yung provide immediate interventions. So, sa mitigation objectives natin na ito, kailangan natin tignan ano ba yung mga specific measures or intervention for schools and offices. Hindi na natin pag-uusapan pa yung mga components ng early detection in schools, yung mga referral, mga testing, contact tracing, support protocols, at saka yung mga support mechanisms for the DepEd, the required health standards, because I know that nabasa na natin ito. And sa mga sharing naman ng mga best practices nyo kanina, na ipapaloob doon yung mga support mechanisms like yung continuation ng ating DepEd task force at all levels, yung pagsasubmit, yung internal situation reports, yung communication plan natin, yung pag-allocate ng budget, nakalagay sa ating budget and finance na funding requirements to implement the provisions set forth in this policy. Guidelines shall be charged to available funds in the COROs, SDOs, and school CLCs under the GAA and or other sources of funds as a result of partnership natin sa mga local government units, the private sector, and other non-government organizations. So let's look at the specific measures or interventions for schools and offices. Bago tayo pumunta sa detalye, tignan natin yung dalawang enclosures at ano ba ang summary ng enclosures na to. For enclosure number 2, nandito yung mga routine protocols for health and safety, physical arrangement in schools, support mechanisms, and screening of returning personnel and learners and testing protocol sa school level. Sa kabila naman po na enclosure, ito naman ay napapaloob naman po dito yung mga offices. So andyan yung routines and protocols for health and safety. Yan. Ang nakikita natin dito nung nagre-review ako, parang yung may typo error dito sa paglalagay ng AB, yung ano niya, yung kanyang AB na-miss dito yung B. But anyway, yung general health and safety protocols, paulit-ulit lang po yan. Kaya kung babasahin mo yung buong guidelines, malilito ka kung hindi mo siya iaayos at lagyan din ng memory pegs. And then it talks about detection and referral din, ano yung mga office activities and events, and yung DepEd health and safety policies. So if you look at difference ng schools at offices, dito kasi sa schools, pinag-usapan yung school clinic and health services. Dito naman sa kabila, ang pinag-usapan naman yung physical arrangement ng offices, which includes establishment, setup or refurbishment din ng clinics. But nonetheless, yung both areas, whether school or offices, ay ina-ensure dapat natin na meron siyang clinic. Sa support mechanisms, pare-pareho lang din po yan. Iba lang yung target. Like kung sa mga bata, kailangan merong yung first few days ay merong psychosocial intervention or psychological first aid or mental health psychosocial support. Dito naman sa kabila, kailangan din na i-prepare natin din yung mga employees natin, or kung nakapasok na, then we can come up with physical and mental resilience module. And we're using, meron na tayong nagagamit from our kapatid from the DRMM. And yung pang-apat, yung screening of returning personnel and testing protocol. So pag-uusapan din po natin yan. Note that to be followed in all basic education schools and community learning areas and DepEd offices, when and to extent that personnel, teachers, non-teaching personnel, and learners will already be allowed to physically return to DepEd schools and our offices. So hindi tayo magtatalo doon na may mga provisions dito na applicable kapag nakapasok na sa offices or eskwelahan yung mga bata. And there are also basic provisions that is applied for both. Kung wala ka pa sa eskwelahan at nasa bahay ka, or kung ikaw naman ay nasa eskwelahan na, pagdating ng panahon, ay meron ding mga common behavioral interventions na napakahalagang sundin natin. So let's look at, nilagyan ko lang siya ng number para kung mamaya kung may mga tanong tayo or para madali siyang tandaan. So palagi yan kahit sa bida ng DOH, pinag-usapan yung respiratory etiquette and other protective measures. So we need to practice physical distancing at least 1 meter apart at all times. Alam nyo, napakahalaga siguro na kapag nag-orient tayo, i-emphasize natin ano ba yung rationale kung bakit natin kailangang pagtuunan or i-advocate itong mga measures na ito. Kasi pwede nating, depende sa kung sinong target natin. Pag mga bata, pwede tayong gumawa ng mga information material na age appropriate para sa kanila. So pwede nating sabihin kapag ikaw ay umubo, nag-sneeze or nagsalita, merong mga spray, nakakapag-spray ng mga small liquid droplets from their nose or mouth which may contain the virus. So if you are too close, masyado kang malapit, you can breathe in the droplets, included the COVID-19 virus, if the person has the disease. Measure number 2, frequently clean hands by using alcohol-based hand rubs, disinfectants, or by proper hand washing with soap and water. So a specific period, there should be a specific period allotted for learners for regular and thorough hand washing with soap and water. Ngayong nasa bahay sila, ina-advocate pa rin natin ito. So yung kanina, yung napag-usapan natin with our previous speaker, that meron na tayong mga standards na ganito, pero meron pa rin tayong tumataas pa rin natin ang mga cases. Ang pinakamaganda at na pwede nating gawin sa regions and the divisions and also in the schools is to monitor paano nga ba sila na-i-implement. Baka naman ini-implement ito pero wala naman silang mga sabon, wala naman silang mga hand washing facilities. So pumapasok dito yung ating matagal ng programa na Wash in Schools program. So kung ano naman walang gumagamit doon sa mga CR, baka naman kailangang lagyan ng mga signs na papunta doon sa yung na-mention kanina na natin with UNICEF. So let's really emphasize itong measure na to, because washing your hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. Number 3, when sneezing, coughing, proper distance must be maintained. Use tissue or inner portion of elbow to cover nose and mouth, and do not cover the mouth with the hand. So dito, titignan mo kung oo nga, ini-implement namin itong measure na to, pero wala namang tissue na available, wala namang mga trash bins, baka ito yung kulang. For the rationale, droplets, we know that droplets spread the virus. By following good respiratory hygiene, you protect the people around you from viruses such as cold, flu, and COVID-19. Measure number 4, observe proper use of face masks at all times. Both nose and mouth must be covered. Kasama rin ito sa bida. And surgical mask, dito na natin i-emphasize, ano ba yung mga iba't ibang klase ng mask? Yung surgical mask, ginagamit natin yan for symptomatic individuals and healthcare providers. But we can use cloth washable face mask, mga ear loop mask, indigenous, reusable, do-it-yourself mask or face shield, handkerchief, or such other protective equipment, or any combination thereof for those with no symptoms. Pero ang napaka-importante dito, gusto nating ma-avoid yung droplet spread ng virus, so we have to wear a mask to avoid infecting others. So siguro sa mga bata, importante rin na i-emphasize natin, ito hindi lang protektahan ng sarili mo, kailangan mo rin itong gamitin para maprotektahan din yung ibang tao. Number 5, practice proper disposal of tissue and mask after use. So droplets spread by virus, and by following good respiratory hygiene, you protect the people around you from viruses such as cold, flu, and COVID-19. Measure number 6, kailangan nating mag-provide and reiterate relevant information on respiratory etiquette and other protective measures that shall be observed in the school or the workplace. So kasama na rin dito yung nasa bida ng DOH na kailangan nating mag-provide ng right information. Yung mga fake news, kailangan natin magbigay din ng mga information para inform yung ating mga estudyante and other target employees. Orientation on the first day of reporting to school. Use available platforms prior to reporting to work, email, SMS, telephone for the workplace. Measure number 7, ensure access. Hindi namin sinabi dito provide. Kung titignan nyo ang pagka-phrase na ensure access to the following. Kasi hindi naman DepEd lang ang pwedeng magbigay nito, pwede ring partners. Pero ang maganda po dito ay na-commit natin through the school dental healthcare program ng pag-provide ng toothbrush and toothpaste sa lahat ng ating kinder to grade 6 learners, at saka yung pagbibigay ng sabon. Siyempre, kung ito ay starter dose, yung ating mga parents din ay kinakailangan din magbigay ng kanilang commitment sa ating mga bata. So yung mga kailangang i-ensure na nandun, gusto natin na magkaroon na mag-face mask, so at least makapag-ensure na merong available mga PPEs. Number 8, ensure availability ng mga sabon, hand sanitizers, alcohol-based solution, other disinfectants in the restrooms, entrances, by doing routine monitoring and replenishment if needed. So if nasa division ka man, region, or sa CO, yung in charge ng pag-provide ng mga supplies, kailangan tinitignan niya ano ba yung pangangailangan ng bawat opisina. Kung ang face mask ba ay ideally every 4 hours at 8 oras ka dito sa opisina, ilan ang nagre-report now that 50%, maximum of 50% ang pumapasok, ilan ang kukumputin mo para makapag-provide ng mga supplies na yan. Measure number 9, ensure routine cleaning, disinfection of frequently touched surfaces and objects. So sino yung naglilinis sa ating mga offices? Kailangan matrain siya kung paano mag-disinfect, ano yung mga solutions na gagamitin, ano yung mga paano i-replace, yung mga solutions sa foot baths, ilan ang foot baths na kakailanganin, saan siya anong strategic location siya nandoon. More intensive cleaning and disinfection shall be done on weekends kasi walang mga tao. And for schools, preferably before the start of scheduled physical classes, once in the morning and once in the afternoon. So, nakikita natin dito, kapag in-implement natin yung standards, kailangan na nakukuha rin natin yung support ng ating mga tagalinis, yung ating mga utility workers. Kasi at the end of the day, meron din silang role na gagawin dito sa ating mga safety protocols. Measure number 10, subject everyone to temperature checks using a thermal scanner prior to entering. Alam nyo, napakahalagang tignan po natin ito kasi like kunwari sa mga regions and division offices, even sa central office, minsan nagdadagsaan yung mga visitors natin. So titignan mo rin, magpro-project ka din ilan yung mga expected na pumupunta doon sa mga offices natin, and kung kinakailangan na magkaroon ng appointments later on, para baka naman pwede na lang itawag para mabawasan lang yung pumapasok. And sino yung gagawa, kailangan din yung naka-PPE rin yung ating mga tagakuha ng temperature checks, lalo na po kapag sobrang dami ng pumapasok sa offices. Those, alam naman na po natin ito, those who will have a reading of 37.5 or above shall be provided with a surgical face mask and sent to a private screening area that shall be set up near the entrance of the school. Huwag nang diretso sa clinic kasi kailangan dito pa lang sa entrance meron ka ng private screening area, or the office where the concerned personnel or visitor can be further examined for appropriate management, intervention, or referral. So nilagay din natin dito, entrance to the school of visitors and other external stakeholders shall be discouraged. So yung non-face-to-face communication shall be prioritized. Measure number 11, kailangan yung teachers natin shall conduct daily rapid health assessment in the classroom kapag ito ay pasukan na ng klase. And all personnel shall report to their immediate supervisors if they are experiencing flu-like symptoms. So nakalagay din dito na kapag meron ng symptoms, bibigyan sila ng surgical face mask and further assess, manage in the clinic. Measure number 12, implement adjustments in schedule, assignment, and activities to allow physical distancing in the classroom or in the school premises. So meron tayo ditong enclosures kung ano yung itsura ng classrooms na merong physical distancing. And then measure number 13, restrict conduct of physical or face-to-face large gatherings. Ginagawa na natin ito, hindi na tayo convene, even sa ating mga conferences ay virtual na rin ang ating ginagawa. For measure number 14, provide and maximize use of online platforms which do not require physical interactions or congregations for the performance of tasks. So we're also, we have coordinated with ICT and meron tayong mga propose din na mga interventions to improve pa yung ating school health. Measure number 15, limit travel only to the most critical or essential official functions. Right now, na-experience ko po yung paano umuwi nung dinala ko po yung bangkay ng kapatid ko sa probinsya. Na-amaze ako dun sa local government units na hindi ka pwedeng pumasok kapag hindi ka susunduin ng MHO or nung MHO and PNP. So cleaner pa sa barangay kung saan ako pupunta, almost half day yon. Cleaner sa mayor, and then cleaner din siya sa governor kung allowed na pumasok. So iba-ibang local government units, iba-iba rin po yung mga measures na ginagawa. So kapag mag-travel ka ngayon, kailangan mo ng hindi lang official travel document, kailangan mo rin i-coordinate sa probinsya kung saan. Kaya sabi ko nga, mas okay na lang na hindi na lang muna pumunta sa mga provinces kasi kahit na in our homes, because of the yung mga checkpoints, grabe, at saka nagiging choke points na siya. So measure number 16, devise and implement alternative means of recording and monitoring attendance. So may mga changes, for example, na gagawin, like yung logbook namin doon na lang sa labas, sa my guard, hindi na doon sa loob. Maybe we can come up with other, yung sa attendance naman, yung mga naka-work from home, meron naman ng system for releasing documents. Ang ating pong USEC, clear po yung kapag may document, merong releasing, merong receiving and releasing. Kapag urgent, ipopost mo sa receiving pero kailangan kang mag-text ka na urgent ang document na ito, yung mga ganon. So, kanya-kanyang offices, kanya-kanyang device na gagawin. Measure number 17, set a flexible dining policy. So, kailangan i-limit natin yung number of individuals who can eat in the pantry at a given time. Discourage lunch outs. So, part ng ating monitoring ay titignan natin kung nasusunod ba ito kasi culture na po natin ito na meron tayong kainan together as a family sa opisina natin. Parang hindi na siya hindi na family kung hindi kayo sabay-sabay kumain. And may mga pagkakataon na ngayon mahirap kasi mahirap pang mag-secure ng food. Minsan may nagdadala ng potluck at kumakain together. So i-monitor po natin ito. Measure number 18, alam na po natin itong preventive alert system that we issued for COVID. Number 19, that's for the schools. And then measures for 19 to 20, strengthen implementation of the FTC memo number 25, minimum standards and social distancing, and develop contingency and response plan for COVID-19. So dito naman sa ating workplaces, nag-issue na po tayo ng mga memo from the DTFC to implement at all levels. Measure number 21, strengthen implementation of DO number 10, series of 2016, policy and guidelines on comprehensive means program. Alam natin na kailangan naming i-advocate ito, hindi lamang hindi lang to support our health personnel, but also to engage yung ating facilities division and also our DRRM counterparts. So nagkaroon na tayo ng orientation with our engineers. So meron na kayong kakampi pagdating sa implementation ng program. And our DRRMs are also very strong in supporting the WINS policy. In fact, dun sa education cluster, kasama ito as a sub-cluster, yung WASH in schools. Measure number 22. Siyempre, hindi naman natin na ihihiwalay dito yung policy natin ng nutrition na kailangan pa rin ay yung pagkain ng tama, sapat at wasto. At pagdating na naman ng klase ay siyempre kailangan tingnan natin yung implementation ng basic policies natin sa nutrition. Measure number 23, last month ay celebrate natin ang tobacco control, National No Smoking Month. And tuloy pa rin po yung pasabog pagdating sa dito po sa tobacco control program natin. Abangan natin yung monthly na mga activities na ginagawa ng school health tungkol po dito sa no smoking month celebration. And may mga na-train na po tayo to provide access to brief tobacco intervention. Napapanahon din po kasi na ngayong nasa community quarantine tayo, ay ma-ensure natin na substance-free or kung gumagamit man, naninigarilyo man, ay makakatulong tayo sa kanilang pag-quit eventually. And communication with LGUs for tobacco control ordinances. Now, measure number 24. So dito naman po sa physical arrangement. Ensure proper ventilation. Open windows preferred. For offices, install temporary barriers between cubicles and tables. And then for classrooms, adhere to prescribed layout. So nakikita siguro natin yung mga kapag yung mga receiving areas, meron ng mga plastic yung mga plastic dividers, meron na lang butas doon kung saan mo ilagay yung ipapa-receive mo para ma-ensure pa na wala talagang contact between yung magpapa-receive at saka yung magre-receive ng mga documents. So may examples tayo ng mga classroom layouts. Measure number 25. Establish and maintain proper sanitation and hygiene facilities. So, i-check din natin, meron bang mga footbaths in all entrances? Meron bang yung toilets ba natin with adequate water and soap? May mga hand washing stations ba tayo? Measure number 26, sufficiently provide the following. Kailangan pala na merong available tissue paper, tissue towel, designated trash bins kung saan itatapon, adequate water and soap, and hand sanitizers. So kasama na naman ito sa ating nire-reiterate lang niya yung provisions for para doon sa proper yung cough etiquette and nakaka-relate din siya sa ating WINS. Measure number 27, display and or distribute IEC materials on health and safety. Meron tayong mga materials na magiging available. It went through already the review ng SHD and yung ating PAS, DRR para magamit as standard materials at the school level. Measure number 28, create and operate a common area for accommodating visitors and clients, as well as designated areas for high-risk groups with appropriate prevention measures. So kunwari hindi maiwasan na pumunta yung isang buntis na magulang sa eskwelahan, saan natin sila ilalagay? Kapag may mga bisita, dapat hindi na siya humahalo doon sa mga opisina or hindi siya nakahalo doon sa clinic. Meron talagang common areas kung saan sila i-accommodate. Measure number 29, ensure setup of materials recovery facilities. These are already in the guidelines ng WINS. Number 30, ensure availability of ICT infrastructure and facilities. Napakagandang best practice po with ICT, PAS, DRRM, and SHD. Yung coordination para ma-ensure na natutulungan din kami sa mga ICT infrastructure. In fact, sa Thursday, this is for the information ng ating mga health personnel, lalo na yung ating mga doctors. We'll be sitting with ICT para tingnan yung app para sa health assessment. So, we may be inviting mga select group muna para tingnan ito, and then we'll give our comments, and then i-revise na naman yung app in time for use pagdating po ng after ng trainings natin on we'll be training our doctors, nurses, and dentists naman on health service delivery in times of COVID. Now, measure 31, 32, and 33. So we talk about school or office clinic for basic services. Kailangan pa rin ng health assessment and physical examination, but we'll use the telemedicine. Siyempre, kung ang basic na tanong, kailangan ko ba gawin yung usual health examination ko kung saan pinapapila ko yung mga teachers at ina-examine sila? Hindi natin siya pwedeng gawin yan. what we can do, yung telemedicine, and kung talagang hindi na kaya ng teacher, i-refer na lang siya. Or kung pwede rin naman na kung naka-set up na may mga high-end din po kasi ng mga clinics na ngayon that they can do dental and health assessment and examination na wala talagang contact. Nasa ano po yon, nasa call ng ating divisions kung paano nila ini-institute yung mga measures. Appropriate intervention, first aid or treatment, proper management of symptoms, including recommendation to take necessary rest at home, referral and follow-up to appropriate health facilities, access to existing telemed platforms, emergency hotlines. Merong emergency hotlines po yung DOH. Sa atin naman sa divisions, alam ko na syempre yung doktor natin ang pwedeng tawagan pagdating ng ng mga health issues or problems ng mga health ng mga personnel natin. In a private screening area near the entrance, a separate space for the sick awaiting referral, dapat nandito siya. And then mental health and psychosocial support, hindi ko na po i-go through yung details nito kasi meron na tayong module na ginagamit ang DRRM for itong mga standard na to, yung about yung sa feelings natin, yung emotions ng ibang tao, paano natin i-link, and then yung saan tayo humuhugot ng lakas, paano i-manage yung mga reactions, yung mga thoughts and emotions, ano yung mga solusyon and social support na available, focusing on positive activities and other relevant topics as needed. Measure number 34. Para sa mga schools, itong first 5 days ay ng physical encounter, it shall be devoted to discussions or facilitations ng mga modules related to mental health and psychosocial support. So, napaka-challenging ito kasi kailangan yung classroom advisors natin magkakaroon din ng training. And for offices naman, meron na tayong mga trained na mga doctors, nurses natin, and also mga DRRMS coordinator on mental health and psychosocial support. So, merong mga initiatives na pwedeng gawin, like you can have profiles ng ating mga employees and ano ba yung mga issues nila. You can come up also with mga physical activities, mga Zumba natin, mga spiritual online activities, and other related mental health and psychosocial support. Measure number 34, yung task force natin ay na-test yung strength ng ating DepEd Task Force COVID-19. Kung paano niya mag-stand strong, and paano niya i-maintain yung collaboration niya sa iba't ibang offices, kung saan napapaloob yung specific task. Like alam natin sa BHROD, nandun yung sa personnel, yung sa curriculum, andun yung ating mga bata, BLR, yung ating mga materials, yung sa NIAP natin, mga trainings, yung sa YFD para sa ating mga provision of support and utilization ng ating mga youth clubs. They shall issue guidelines also on mental health program and psychosocial support. So ito ay ano yung naka-schedule na gagawin natin dito, we will continue yung drafting ng ating mental health and psychosocial, yung ating school mental health policy, and also we will also continue to provide technical support sa iba't ibang opisina and work with the RMS with their policies. So measure number 35, engage learners in at least 60 minutes of daily physical activities. Ito naman po yung input ng ating sports division. And encourage adults to engage in at least 30 minutes of daily physical activities. So may guidelines tayo for the information of the group. 2010 Physical Activity Prescription, Philippine National Guidelines, in physical activities. Measure number 3637, physical examination for personnel. So nandyan yung ating basis and guidelines for the delivery of learner support services, specialized services, and health and nutrition services in the context of COVID-19. So for issuance pa itong measure na to. Provide alternative arrangements provided to members of the most at-risk population. So ang gagawin natin, di ba, dapat may profile tayo. Kung sa AWA, may profile tayo ng mga employees. So i-separate mo na yung mga employees mo na mag-work from home kasi sila ay 60 years old and above, or sila ay may comorbidities, or meron silang mag-isa lang sila at ang kasama ay mga magulang na may mga comorbidities din or mga elderly. So nasa sa atin na mag-identify sino ba yung mga dapat nating i-work from home. Explore partnership to provide assistance to members of vulnerable groups. So kung mga hindi maiiwasan na talagang yung mga skeletal forces, sila talaga yung mga staff natin na hindi kayang i-deliver ng work from home yung kanilang services, kailangan din nagpro-provide tayo ng transportation sa kanila at saka yung kanilang mga PPEs, and we also look at social amelioration efforts. Measures 40, 41, and 42, pinagsama ko na po ito kasi ito yung sa provide ng compensation and benefits to those involved in COVID-19 response. So kasama dito yung mga hazard pay, kasama rin dito yung mga other benefits like yung mga transportation allowance, yung pag-provide ng necessary assistance to personnel required to physically report to school, yung kanilang accommodation kung kinakailangan, travel pass, communication allowance, transpo, vitamins, if necessary and practicable. So depende sa iba-ibang opisina po ito. And provide logistical support for personnel and work from home. So kailangan buo pa rin yan yung team. Work from home yan or on-site workers ay kailangan pa rin na nabubuo natin yung teamwork sa kanila, and both shall be also provided with the necessary support. Measure number 43. So ensure the availability of emergency health kits and PPE. So naglagay po tayo dito ng may mga tables tayo dito para mas madali siyang maintindihan ano yung activity. So kung magtra-triage ka and mag-screening sa mga entry points sa school, syempre kailangan dyan available yung medical mask. Mag-care ka for a suspected case of COVID-19 with no aerosol generating procedure. Syempre nandyan yung medical mask, goggles or face shields, gloves, and gown. Caring for suspected confirmed cases for COVID-19 with aerosol generating procedures. So goggles natin or face shield, respirator, yung N95, gloves, and gown. Pagdating naman sa technical specifications, ito ay kinuha lang din natin sa sa DOH kapag magpro-procure, ay ito yung mga technical specifications. Measure number 44. Observe the proper protocol on screening returning personnel and learners. So ito ay nakapaloob naman ang details nito dun sa alternative work arrangements. At meron din tayo actually sa page 24, yung screening of returning personnel and learners and testing personnel. So measure number 45, observe the DepEd testing protocol. We won't talk about the details. Ang gusto ko lang i-highlight dito sa proper protocol and screening returning personnel and learners. Napakaganda yung mga tanong and mga discussions kanina kasi we still follow the guidelines, 'di ba? Yung indiscriminate testing, hindi dahil may pera ka gusto mong i-test lahat-lahat ay pwede na. Meron pa rin tayong mga guidelines na sinusunod, and if you look at yung guidelines natin ng testing, meron siyang priorities eh. Tingnan na lang po natin yung guidelines kung ano yung mga priorities. Pero hindi tayo, yung na-mention kanina ni Dr. Ho, yung sa testing, yung mga enhanced guidelines ng expanded guidelines for testing, kasama kasi doon yung mga asymptomatic and as one of the priorities, pero least priority siya, and we're waiting for the yung ilalabas na memo para ma-consider ito na doon sa sa reimbursement sa PhilHealth. So we will wait for that, but nonetheless we have clear guidelines dito on prioritization sa testing. Measure number 45, yung observed DepEd testing protocol. Ina-highlight ko pa din, inuulit ko lang, nasa context din natin sa DepEd. Pwede kang magkaroon, nag-test ka man ngayon, pero yung behavior mo naman, kung saan ka na naman ulit gumala, ay hindi ka rin na-ensure. So hindi nakahiwalay itong testing protocol with the measures, lahat ng measures na pinag-usapan natin. Kailangan pa rin natin yung behavior change communication, kailangan pa rin natin mag-adhere doon sa bida, yung 4 na bida, yung mataas po kasi ang evidence-based na ito ay nakaka-mitigate around 85%. So nandyan po yung uulitin natin ulit, physical distancing, yung wearing of face mask, saka yung mga hand hygiene natin, and proper information dissemination tungkol sa COVID-19. So again, nagpapasalamat po ako, and we can come up with the recommendations, ano yung mga pangangailangan ng ating health personnel right now that we already have the standards. Anong capacity building ang sa tingin nyo ay pwede nating gawin? Nakikinig ako kanina, like maybe we can come up with a tie up with the DOH on yung sa contact tracing, kasi although nasa LGU yun, we can assist yung ating mga health, yung ating mga doctors natin, they can assist dun sa contact tracing. So that's one thing that we will be scheduling, yung trainings on how to assist doon sa contact tracing. Also, training ng ating mga clinic teachers, we will also be doing that. And yung trainings natin related sa school dental healthcare program and orientations related naman sa ilalabas na guidelines on school-based feeding program. So we will appreciate yung mga possible inputs po ninyo sa mga pangangailangan nyo sa field. Maraming salamat po.
Thank you very much po, Dr. Lau, for your very comprehensive presentation on DO12 or yung DepEd Required Health Standards po natin. Kung makikita niyo po, isa-isa po ni Dr. Lau yung 45 measures stipulated in our DO. So, at this point, we encourage the participants to ask directly kay Dr. Lau. But, Doc, I just have one question. Basahin ko lang po yung question ni Ma'am.
Okay, so that was Dr. Dumlao or Dr. Maria Corazon C. Dumlao of the Bureau of Learners Services School Health Division po. Siya po ang head po doon na division sa regional office. So, we would like to thank again po Dr. Dumlao for presenting the 45 na mga priorities po ng ating DepEd Required Health Standard. Again, those standards anchored pa rin po sa DOH po na protocols and guidelines. So, hindi po tayo nawawala sa guidelines na set po ng DOH for the response of COVID-19, especially that we are opening our classes this coming August 24. May modular, meron ding online, but we're still hoping na soon, if maging okay na po lahat, hopefully ma-okay na lahat, we will go back to yung normal po talaga natin na pag-teach, no? Especially to our learners, teachers, and other non-teaching personnel of the division and the whole family of the working force of the Department of Education. So, before we proceed to our next topic, which is the required health standard intervention, allow me to answer some of the queries po na binigay po sa atin dito. So first is, sir, meron po ba kayong ibibigay na copy of the presentation ni Dr. Dumlao? Regarding with the presentation, it is again po, recorded po siya na binigay din sa atin. So don't worry because this is a recorded presentation po or recorded activity po natin, which is you can get or you can review again po sa ating FB, sa Facebook po natin, at saka sa YouTube. And I would like to say thank you po sa ating 189 na viewer po sa ating YouTube account, Division of Davao Oriental, and we also have 115 sa Facebook page po natin. So maraming salamat po. And also don't forget to enter po doon sa binigay kanina po na link for our attendance is needed po siya. Ito, nandito na po sa screen. Please po, kindly pwede later po, kindly copy the link po na nasa screen po natin ngayon because we will be giving certificates po to all the attendees. So, kailangan po namin ng complete name ninyo kasi last time na ginawa po namin ito, ang nilagay lang po nila is yung first name lang po nila. So, we would like to ask everyone to please write down your complete name, your email, especially your email and your school for us to know kung ano ba yung kompletong pangalan ninyo at saan kayo na school na hello. Okay? So, regarding sa PowerPoint presentation, again po, this is a live or recorded activity so you can review it sa ating Facebook page at saka YouTube account natin sa Division of Davao Oriental. Okay, so I guess we are ready for our next presentation, which is the required health standard inventory for all schools po, sa lahat po ng schools sa Division of Davao Oriental, to be presented by our former colleague of the division and right now a school health nurse sa region, a product of Boston National High School. So help me welcome Sir Stephen Mark Castres to present the required health standard inventory. Hello, sir. Good morning.
Hello, Sir Mac. Good afternoon.
Hello,
Good
sir.
morning.
So I will give you the screen for your presentation po.
Okay po, sir. Okay. Before we start, my courtesy lang po sa ating SDS of the Division of Davao Oriental, Sir Rinaldo Millorida, and to the OIC SDS, Ma'am Esther Jean Pilayo, to the SGOD Chief, Sir Ernesto H. Cabanes, to the CID Chief, Ma'am Concepcion Wong, to our participants, the division health personnel, the school heads, at the same time, the field health and nutrition personnel, our clinic teachers, including our school DRM coordinators, my pleasant good morning to each and everyone. I-share ko lang yung screen ko kung ano yung ating gagawin with regard sa inventory. Ito po yung inventory natin is like lang parang sa ano lang po. Nakikita na po ba ang aking screen? Kita na po ba ang screen, Sir Mac?
Klaro na po, sir.
Okay. Nakikita na po ang screen? Okay. This is the DepEd Required Health Standards Inventory in Basic Education School. Ang ginagawa po natin dito, itong inventory is an inventory platform of the DepEd Required Health Standards na ibabalidate po ng ating mga school health section in the respective division on the month of September. Ang deadline po ng ating pag-encode nito is on August 10 to 14, 2020. According po sa ating regional memo po. Nakalagay po ito sa ating regional memo. This tool will serve as our guide in compliance to the required health standard as well as preparation in the start of the new school year in this time of pandemic. Ano po ang nakalagay dito? Simple lang, sa first page po nito is humihingi po ng inyong email address. This will be filled up by the school health coordinators or yung mga nurses natin kung nandun mismo sila sa school. Example, sa Katiil Vocational High School, si Ma'am KitKat, sa isang school lang. So, siya na po ang mag-i-encode. Name of school, if you fill up po, at saka anong division, may ano lang po, may option lang po yon. School ID, ano yung school ID, then name of respondent or kung sino po yung nag-fill up ng ating form. Okay, for the section 2, ito po yung first na i-address niyo or answeran nyo. Ito po yung, ang nakalagay po dito is yung General Health and Safety Protocols. Basically po, kung ano po yung nakalagay doon sa ating health standards na which is presented po by Dr. Dumlao, is yun din po yung nakalagay dito. First one, example po, sa General Health and Safety Protocols, ang nakalagay po is physical distancing at all times, at least 1 meter policy, which is dapat na mayroon kayo na sa mga schools. Okay, if ever yes ang inyong sagot, ititik nyo lang yung circle na yes, pero kung no naman, lalagyan nyo ng remarks kung bakit hindi pa kayo nagkakaroon ng physical distancing na policy within sa inyong school. Okay. Another one, i-rundown ko lang i-rundown ko lang yung ating mga section ha. Hindi ko na ito yung yung mga nakalagay sa ating per section. Ang section 2 naman is all about detection and referral. Ang nakalagay example dito is body temperature check using the thermal scanner prior to entering the school premises. If yes, ganun din yung gagawin is i-tick lang yung yes, then if no, bakit hindi pa ito nagagawa? Siguro yung iba hindi pa nakaka-secure ng thermal scanner. Okay. Next na section po is all about the activities and events. Example po dito is the implementing of adjustments in schedules, assignments, and activities to allow for physical distancing in the classroom or in the office premises. Ganun lang din po yung gagawin. Yes or no lang po. Then, next one naman po is Section 5 of 9. Meron po tayo dito, DepEd Health and Safety Policies. So, basically, ang nakalagay po dito yung mga safety policies at saka health policies natin. So, example po dito is operationalization of the preventive alert system in school for COVID-19, which is the basis nito is yung DepEd Memorandum number 15 series of 2020. Yun, ganun din po yung gagawin lang, yes or no lang, check lang natin. Next na section po is all about physical arrangement. Example po nito is kung yung classroom or offices ba natin is may proper ventilation. Preferably po yung open windows po. Ganun lang din po, answer lang po, yes or no. If no po, lagyan lang po ng remarks bakit wala pa po or hindi pa po nagagawa or nako-comply yung ating standard, isa sa ating mga standards. Next po is yung section 7 po, the physical and mental resilience. Example po nito is the provision of the mental health and psychosocial support to our personnel and learners. Yes or no lang po. Then next po, second to the last, the administrative support po. Nakalagay po, example is conduct of physical examination for personnel per RE 11223 or the Universal Healthcare Act and its IRR or the implementing rules and regulations. Yes or no lang po. Kung no, lagyan po ng remarks. And lastly po, the screening and testing. Example po nito is observing the proper protocol on screening of returning personnel and learners. Ganun lang din po, yes or no lang po. Basically po, kung bibigyan na po kayo ng link, ganito po yung makikita nyo. Ganito po siya. Merong mga asterisk po with regards sa mga, example po, sa email address, may asterisk, which means na ito po ay required data po. Ganito po yung magiging kanyang hitsura pag open nyo ng link. Ibibigay po ito sa inyo ng division. Ang importante lang po na hindi dapat na makaligtaan is dapat i-bookmark po ninyo ang URL or ang address para ma-edit po yung page after you click the submit. Paano po mag-bookmark? I-click lang po ito pong star na sign. Bookmark this tab. After you click the submit, i-click lang po itong star na sign, then done. click done. And yan lang po. Ganyan lang po. The deadline of the submission of this online inventory form is on August 10 to 14, 2020 para po natin makonsolidate by division ang mga inventory form, then at the same time makita po natin ano po yung mga kulang sa mga schools. At saka while as sort of preparation na po natin sa ating start of classes. At saka i-validate din po yan by September, on the month of September po. Or pwede po at pag-start na po ng klase. Depende po sa division health section at saka sa DRRM coordinator natin or sa ating DRRM COVID-19 na team na nasa division po. Basically, yun lang po yung nasa loob ng ating required health standards inventory, online inventory form. Ibibigay po ang link sa inyo. Naka-ano na po ako ng link, naka-share na po ako ng link sa GC ng mga kasamahan ko ng mga nurses. So, probably pwede rin din po sila ang mag-share sa inyo. Thank you po sa pakikinig at yun lamang po. Sir Mac?
Good morning, sir. Thank you for your time, sir, no? Especially na busy ka talaga karon, no? Sir, but before, can you ask a question po kasi may mga question lang po dito sa division po regarding po sa paggawa nitong required health standard inventory na form. So, may question po, one of our questions from our principal po, sino po ba yung magko-comply nito or gagawa po yung sa form po ba? Okay lang po, principal, coordinator, or health coordinator po, or DRM coordinators?
Basically, health coordinator po, in partnership po with the DRM coordinator po, at saka pwede rin po i-oversee ng principal para makita po nila.
So, ikaro ko, sir, ha? So, regarding sa form, pwede ang mag-comply nito is ang DRM coordinator, ang health coordinator sa school, at saka makita po before sa submission ng ating school heads.
Para po makita nila na yun po yung mga na-comply na nila or ano po yung mga kulang nila.
Sir, regarding na din po sa district, district offices, paano po yung sa district offices po?
Basically po, itong online inventory form po natin is ano lang po siya, tailored fit po para sa mga schools. Pero nakita ko po sa mga responses po, may mga district offices na po na nag-comply. Ang nag-comply po nito is ang mga district nurses po nila. Sa ibang division po.
Sir. So, thank you. Okay, sir. So, pwede yung sa district, sir, pwede na sa gamitin itong na form. Okay lang itong na gamitin. Okay. Sige,
pero
sir. Parang wala na tayo. Yes,
sir. Pero hindi natin encourage talaga na mag-comply ang mga district kasi ang naka-tailored fit talaga ito sa schools po. Since yun po ang ating prepare para sa opening of classes po.
Okay. So, Sir Stephen Mark, so thank you kay sir ha sa imong time, sir. Especially, he's really a colleague po namin before dito sa Boston National High School and the division. So again, sir, thank you so much for your time. The next time na po, sir, basin tawago na po ka na. No? So,
sige, sir.
Anytime.
Anytime,
okay,
sir. Okay lang, sir, ang koan.
Sir, regarding later, sir, basin natay question and answer, especially itong presentation ni Ma'am Dumlao. So, can we ask you to stay for a bit lang, sir? After this, another presentation, sir. Okay lang, sir?
Okay na, sir.
Okay. So again, sir, thank you kay Sir Stephen Mark T. Castres, School Health Nurse sa Regional Office po ng Department of Education 11. Okay, so to continue our activity po, it's really a pleasure for us na we have this active speaker po, no? Andito po sa province of Davao Oriental. So allow me to introduce our speaker to discuss po the current situation of our province in response po of COVID-19. So a graduate of or finished his basic education at Mariano Peralta Elementary School and also finished his secondary level po sa Holy Cross of Malita and finished his Bachelor of Science in Biology in Ateneo de Davao University. Also finished his Doctor of Medicine in Davao School Foundation in Davao City and also a graduate of a Bachelor of Science in Nursing in Ariscado College Foundation and completed his Master in Health Care Administration in St. Jude College. He is currently the Provincial Health Officer 2 of Province of Davao Oriental and the Incident Commander of the Interagency Task Force of Davao Oriental in response of COVID-19. Help me welcome po Dr. Riden V. Bersaldo. Doc?
Good morning everyone.
Hello, Doc. Good morning po.
Good
So again,
morning.
it's a pleasure for us to invite you po your
Yes, thank you for inviting me. Thank you.
So Doc, ibigay ko na po yung screen po Doc for your presentation
Sure.
po Doc. Thank you Doc. Pwede na po Doc.
For a while. Okay, so good morning. Today's presentation will be centered on two things. No? The first presentation will be the latest update of our COVID situation here in Davao Oriental in all the 11 LGUs. And the second update, we will be talking about some of the tips that we can give you that you can use when schools open, whether it will be in modular type, face-to-face, or through online education. So this is the first of our presentations for today. So these are the latest updates sa Davao Oriental COVID-19 fight as of August 2, 2020. So as of today, we have 110 confirmed cases in Davao Oriental, 61 of whom have already recovered. Our recovery rate in Davao Oriental is at 55%, one of the highest in the Davao region, along with Davao del Sur and Davao City. We have one accounted death from the municipality of Lupon, and we have a total of 48 active cases, most of whom are in our TTMFs, our treatment and monitoring facilities. And then, so this is a bird's eye view of all the active confirmed and recovered cases in all the 11 LGUs of our province. Yesterday, we have had 10 recoveries, 9 of whom come from Mati City, and 1 from San Isidro. DOH, right now, I had just finished my Zoom meeting with them. DOH will strictly enforce the Department Memorandum 2020-0258 as with regards to the definition of our recovery cases. So expect that in the next few days, we will register more recoveries. And I will also be coming out with infomercial and Facebook Live with regards to DM 2020-0258, particularly focusing on recoveries, the definition of recoveries in our COVID-19 patients. So this is the distribution of the confirmed cases per municipality. So as I've said, we have already 110 confirmed cases. If you're going to compare it about 2 months ago, 2 to 3 months ago, we only had 24 cases. So nakapaspas nagdagan na ato ang mga cases diri sa ato ang probinsya sa Davao Oriental. Then later in this slide, we will see kung asan ni sila gikan. So this is it actually. So out of our 110 confirmed cases, in which we have a 55% recovery rate, 81% of the total of these cases come from our returning overseas Filipinos and locally stranded individuals. So if you're going to look at the pie graph, no, kasagaran yun are LSIs who are contributors of our positive cases, followed by our returning overseas Filipinos, and then those with confirmed travel to areas with local transmissions, and also in areas with high risk possibilities, matakdan yun, especially in barangays in Davao City tagged as high risk areas. These are our returning residents. And then we have 3 cases with unknown exposure and 6 cases with confirmed exposure to a positive case. As of today, 87% of our confirmed cases are asymptomatics, meaning wala gid sila symptoms, no? Not even a simple colds or a simple cough. While 14 of our cases are symptomatic, 5 of whom are currently admitted at Davao Regional Medical Center, our referral hospital. So in terms of sex distribution, 65 of our cases are female and 45 are males. And then when it comes to age group, as you can see, 80% of our confirmed cases belong to the 22 to the 59-year age bracket. These are the people, understandably, nga nagasigi og gawas during the entire quarantine period, whether it's an MGCQ, a GCQ, or an ECQ, because we still have an interim guideline as to the prohibition of those less than 21 years old and those above 60 years old to go out of their homes unless they are for essential purposes. So I believe na this could be a contributory factor to the high number of cases, about 80% in the age bracket of 22 to 59 years old who are afflicted with COVID-19. So this is a status of the total number of LSIs and ROFs that we have catered in the province so far. So we have 277 total returning overseas Filipinos for a positivity rate of 6.5% and a total of 1,099 returnees, locally stranded individuals, with whom 72 of them tested positive or a positivity rate of 6.4%. So basically, that's the whole picture of and if you're going to ask, what did we do with most of these cases? We already had a standing policy with our province here in Davao Oriental with regards to risk testing and isolating all of our confirmed cases. So most of our LSIs, in fact, all of our LSIs, nearly 100% of them, and our returning overseas Filipinos were immediately isolated upon entry here in our province. They are tested right away, depending on their days of exposure from the other areas, and then negative results will have to be, they will have to have a negative result before they will be sent home after 14 days of quarantine. So right now, we are also proud to say that the province of Oriental, despite having 110 confirmed cases, also registered the most number of tests conducted to the population. The last time we have had checked, we have a total of 2,137 cases. Tested individuals here in Davao Oriental. And that was about a week ago. So kung tanaw na ito, mas daghang pag ang atong test, ana. In contrast to other provinces, naiuban sa ubang mga probinsya in the Davao region, which I will not name anymore, they only tested about 200 individuals. So that's how we really extensively are conducting tests para makasiguro kita that everybody is safe here in our province. So that sums up the updates on our COVID-19 fight here in Davao Oriental. So the next slide that I'm going to show you is just actually some of the we call this tips or advice that we can give you from the provincial task force when it comes to setting up the new normal for learners and educators in our province. This is COVID-19 in the education setting. So we have slides here, tips on how you are going to conduct. I believe our previous speaker already gave some inputs when it comes to how to set up the new normal in terms of learning for both the students and the educators as well as, but this slide will also give us some insight as to how we will be able to address issues when it comes to the community and also with the parents of our students. So I will just browse through this because this is already a what they call this, a common knowledge for all of us with regards to what is COVID-19 and then the symptoms involved in it. So, baliko na nako. So there is cough, sore throat, fever, muscle pain, chills. Also included anosmia or the loss of smell and dysgeusia as the distortion of our taste as one of the prodromal symptoms or the initial symptoms of COVID-19. So before, wala kayo ni siya na highlight, but CDC and WHO already included this one. The most common symptoms that are often experienced by COVID-19 patients include cough and fever, accounting for more than 80% of the symptoms, while colds alone account for more than 50% of the COVID-19 confirmed cases. Most of them experience a loss of smell and taste during the initial stages before cough, sore throat, or fever ensues. Okay, so how does COVID-19 spread? Two things. The main driver of transmission is still direct contact. So this is from aerosol droplets, and then I'm sorry. I would like to stand corrected. The main driver of transmission is still respiratory droplets, while a few percentage is by direct contact, such as fomites, like the use of our utensils, sharing food, and others. No, so there are no um, peer what do you call this, approved, peer-reviewed evidence as to the aerosol transmission mode of COVID infection. No, so all the reports that you can see in the social media or in the news about aerosol transmission as a mode of transmission of COVID-19 are anecdotal reports. No, mainly ginastorya lang. There are no peer reviews that really support aerosol transmission as another form of transmission for COVID-19. So right now, it's still respiratory droplets as the main mode of transmission and then direct contact. And then who is at most risk for getting COVID-19? We know this already. The older people, the vulnerable populations, those immunocompromised with chronic medical conditions like lung diseases, HIV, immunocompromised individuals, those cancer survivors, diabetes. But they found out in researches as well as in studies that a huge number of those chronically ill who are prone to be mortalities for COVID-19, as well as they are most prone to have COVID-19 are those with cardiovascular illnesses, no? Katong may mga sakit sa kasing-kasing. But the rest still pose a greatly equal chance of getting COVID-19 or having mortalities with COVID-19. So, as we have known already, there are no treatment or vaccines for COVID-19 yet. So the vaccines have to undergo 4 treatment trials, no, and protocol. The last one of which is marketing surveillance, which may take 1 to 2 years before it can be finally approved. So we can see that in the near future, COVID-19 will still stay with us. So we get to learn to live with it for the next 1 or 2 years until a vaccine or a definitive treatment for COVID-19 is in the market already. So how can we slow down the spread of COVID-19? So we have been talking about this ever since we started a quarantine period here in Davao Oriental. The main protocols that we really have to follow in order to slow down the transmission of COVID-19 is, of course, to follow the minimum health protocols, including wearing of mask, especially when going out to crowded places or talking to strangers. And the most important of which is to observe physical distancing of 1 to 2 meters or 6 feet. You reduce the chance by 90% of not being infected with COVID-19 if you practice physical distancing and you wear your face mask all the time. You reduce the risk of getting infected with COVID-19 by 80 to 85% if you wear your face mask properly. And of course, you wash your hands often, practice personal hygiene, you cover your mouth, and practice cough and sneezing etiquette, especially when in crowds. You disinfect frequently touched surfaces such as doorknobs, your cell phones, your eyeglasses, your tables, and others. And then you stay home when you're sick, or you stay home when you do not have essential purposes outside of your home, even if we are already in MGCQ period. And then you get adequate sleep, you boost your melatonin, and then you boost your immune system. In that way, you can fight other infections, not just only COVID-19. And you eat well-balanced meals, you find ways to balance your physical and mental health, such as kanang nauso nato karon nga magpananom og mga bulak, or find ways to divert your attention from the stresses of handling COVID-19. And also, addendum lang, you call your doctor before visiting. Telemedicine hotlines are now available also here in our hospital in DOPMC. So now we are going to talk about COVID-19 in the education setting, the main purpose of which is to protect our children and educational facilities from COVID-19, because schools, along with enclosed institutions such as mga prisuhan, our rehabilitation centers, are high-risk areas for transmission, no? Nga pwede mahurot ang isa ka classroom if in case ka na face-to-face nga education na mahitabo. So, along with, ensuring that there is no infection in our schools and in our in our educational facilities, another important thing that we must note is to avoid stigmatizing students and staff, especially if we will be able to find out that there are close contacts in our schools from COVID-19 cases. So, maningkamot nga walay discrimination nga mahitabo. So, the basic principles that we are going to adhere, these are suggestions that I am going to throw to you, especially for our school administrators, teachers, and staff. So, these are some of the basic principles that we can follow. So, one of which is not rocket science, no? Sick students, teachers, and other staff should not come to school, especially if you're experiencing respiratory problems such as cough and fever, colds, and others, flu-like symptoms in particular. So, schools should enforce policies for regular hand washing with safe water and soap, alcohol, and alcohol-based sanitizers, among others. And importante yun kayo that there should be daily disinfection and cleaning of school spaces, particularly katong mga frequently touched areas that I've mentioned a while ago. Apil na ana ang mga doorknobs na permanente ginagunitan sa ato ang mga teachers and students. And then, the school should provide water, sanitation, and waste management facilities and follow environmental cleaning and decontamination procedures, including setting up more washing areas in your schools. If before, katong wala pa rin COVID, pre-COVID era na to, no? Our wash bins in school number only about 10, we should consider doubling or tripling the numbers of wash bins in our schools, particularly not just only limited to school canteens, but even sa entrance atong schools, sa playground area, in areas where most students congregate, so we can include more wash bins in those areas. And then, school should have a strong policy that would promote physical distancing or social distancing, no? And then, it is also very important for administrators, teachers, and staff to know the latest facts on COVID-19. Get updated on the latest executive orders, policies in your localities, as well as in the national counterparts. No, we know the latest facts in order to ensure that we can operate the school safely. And then we update or develop school emergency and contingency plans. I'm sure you already have this. We work with officials in our localities as well as in the regional and national level. You work with the provincial task force, no, on COVID-19, with your local health officers, your MHOs or your city health officers, and then also with the legislators with regards to some policies that may be newly implemented in your areas. And then Consider canceling any community events or meetings like mga parents teachers association meetings, school meets, mga palaro, etc., etc. No? So, like what I've said a while ago, we need to ensure frequent hand washing in our areas. We cannot underemphasize this. So we procure needed supplies, we clean and disinfect school buildings, classrooms, and especially water and sanitation facilities. No, I will show you later on the cost-effective and economical way of disinfecting our schools without necessarily buying alcohols in bulk. If you have alcohols in bulk, much better. But if you have chlorine and water, you can use that already as the main recommended disinfection solution for establishments, including your schools. So also, like what I've said, we need to implement physical distancing practices that may include the following strategies, no? Staggering the beginning and the end of the school days for different grade levels, no? So pwede nga dili dunganon ang pag-open sa mga classrooms if in case na naagyud tayo face-to-face nga education nga mahitabo, no? So pwede ang grade 1 siguro nimo aning nga oras, the other higher grade levels siguro nimo ning oras, such that they will not crowd kung sulod sila sa school. And then, dili pod mag-crowd when they exit the school. So like what I've said, we cancel assemblies and when possible, create space for children's desks to be at least 1 meter apart. If, sama sa akong balik-balik kong sulti na face-to-face education nga mahitabo. Then we teach and model creating space and avoiding unnecessary touching. This one needs to be really strictly exercised and implemented by the teachers. So the teachers should serve as the role models of physical distancing and avoiding unnecessary touching, including unnecessarily touching your face mask when you are using it. And then establish students procedures if students or staff become unwell, kung naay magkasakit, what do? So you update the emergency contact list, whether kung magkasakit sila inside your school or at home. So you update your emergency contact list home to sa school, no? Kinsa ang inyuhang dapat i-approach. Like you get the emergency contact list of your MDRRMO or your Provincial Disaster Risk Reduction Management Office, your Provincial Task Force, the COVID hotline, and others. And then ensure a procedure for separating sick students and staff from those who are well without creating stigma. So for this one, I would suggest to all schools to allot even a simple 1 room, no, sa inyuhang schools, which you will designate as your containment room. If in case nga naadyo magkasakit and you found out that that person or that student or that staff has a history of exposure to a confirmed case or a history of exposure to an area with high level of transmission. But I'm sure nga before pala makasulod sa inyong school na inyo na siyang na screen or na triage. So the school should also adopt policies where appropriate, like flexible attendance and sick leave policies that encourage students and staff to stay at home when sick or for when caring for sick family members. So we do not punish individuals na dili maka-perfect silang attendance. In fact, we discourage awarding the perfect attendance this time around, no, during this COVID era, no, because we do not know that these people could be attending to sick individuals in their communities. That's why they were absent. Or if we continue to reward kind of perfect attendance, students who are sick may be forced to go to school, no, and we may not know if they're already infected with COVID-19. And then we implement school absenteeism monitoring system, especially for frequently absent students or in cases when there are clusters of infections. Like for example, you may notice that in the process wherein you have been going on with your classes, you notice that students from a certain purok or from a certain household are all absent at the same time. So those are what we call clusters of infection. So take note of those cases, no? Because we may not know na isa na din kapurok sa inyong barangay ang affected by COVID-19 or isa gid ka household. And then, halimbawa, in a family of 5, wherein 3 children go to school para mag-eskwela, 2 are absent. And then upon your investigation, nakita ninyo that the parents are also sick with respiratory symptoms, and yet one of the students came to your school to go to classes because he is asymptomatic. So, importante yun kaayo to keep track of cases of clusters of infections in your locality, clusters of ILI or influenza-like illnesses. So we monitor our school attendance. That's what I've said already. And then we plan for continuity of learning. I'm sure you already know this, the use of online and e-learning strategies or modular strategies like assigning reading classes for home study, radio, podcast, or television broadcasts of academic contents for those who can afford it, and for those who have better internet signals or internet connections, and then assigning teachers to conduct remote day or weekly follow-up business, whether by observing physical distancing, of course, and then we also suggest reviewing or developing accelerated education strategies, no? Like those who are mga bright jud kayo, we accelerate them. And targeted health education by integrating disease prevention and control in daily activities and lessons. Like you can include role playing for elementary school students with regards to what will happen to them if they are not going to comply with the observance of our minimum health protocol. Bawa, dili sila magmask, magmugawas. So you can do it by role play. And then, of course, we address mental and health psychosocial support needs. By the way, we have a mental and psychosocial hotline in the province, courtesy of our partners from Davao Oriental State University, and then also with Red Cross and the parish of the Diocese of Mani. And then we continue to support vulnerable populations. Okay, so this is a checklist of what we're going to do. Parang summary lang siya sa ako ang na-discuss kanina for school administrators, teachers, and staff. Of course, we promote hand washing for 20 seconds by singing happy birthday twice, no? So we rub our fingers. YouTube provides, WHO provides a very detailed demonstration on how to do proper hand washing. And then, separate toilet for boys and girls, soap and water available. We encourage frequent and thorough hand washing, sanitizers, separate clean toilets and latrines, and then we disinfect, and then this is it, no, for disinfection. So we use chlorine powder only. Okay, so 1 tablespoon of chlorine powder to 2 liters of water can be used for disinfection. So you dissolve your chlorine powder na isa ka kutsarita sa 2 ka litro nga tubig. Mao na siyang inyong solution for use sa mga frequently touched surfaces. And as much as possible, kung mugamit gani mo og spray, kung mag-disinfect, dili siya spray diretso sa surface. Why? Because there might be the virus might be aerosolized, no? So, spray ang inyong disinfection solution sa trapo before itrapo sa inyong mga surfaces. Okay? Bunako. So, kung naitrapo o na-spray nga inyong gamiton for disinfection, spray sa trapo before itrapo sa inyong mga frequently touched surfaces. Then, kung mahubda na og alcohol, you can use still chlorine, 1 tablespoon to 20 liters of water as your disinfection solution for hand washing. Okay? Lobat. Lobat, please. Lobat. Okay. Oh my, nalubat. Namatay.
Ay, ikaw na lang sana.
Hello, Doc.
Ay, sorry.
Nagkapan siya. Okay, we are experiencing po some glitch po. That's the equivalent of technology. So we will wait for Dr. Bersaldo to continue his presentation po, and before he continue po the presentation, requesting everyone, especially katong pag-upal lang nakasulod, regarding sa atong attendance, we will show the link on the screen there. So you just go there talaga. Just click the link po or type that in sa inyong sa Google, so it will appear po, and just answer all the needed informations, because we will be giving certificates. So I hope kindly complete your name po, full name po natin, the school, and the email. It's really needed po for the certificate. Okay? And also regarding sa presentation ni Dr., again, this activity is a live activity or recorded activity. You can rewatch po this activity on YouTube sa atong official channel, sa Division of Davao Oriental official channel, or sa ato ang official page sa Davao Oriental or Division of Davao Oriental. So you can choose what platform you want to rewatch this activity regarding sa ato ang DepEd health standards, no? So while waiting kay Doc, again, I will answer the one question katong regarding atong eskwelahan to be used as, pwede na ito ma-flash sa screen, sir. Katong to be used as a, so na-question si Ma'am Rufina Ilanan. So what is it that schools are being identified by the local government units as quarantine or isolation facilities if we are to operate the school safely? So murag ang pangutana ni Ma'am is why ngano daw napili ang local government napili sa mga local government units ang school as quarantine area or facility. So regarding that question, Ma'am, it was before it nainigawas na memo, no, na sa atong central office on how the local government units can use the schools as facility. Pero nakabutang po dito kung hangtod kanus alang, no? May 30 lang siya kutob gamiton. So farmo tong nakabutang sa ato ang guidelines sa central office. So regarding so far karon wala man tay schools na ginagamit pa kay as per info from our local government unit kay nagka-coordinate man ta, no. Karon so far ang ilang ginagamit, ang ilang identified na mga facilities under sa ilahang local government unit, like sa ilahang nasa mga vacant na mga facilities sa RHU ug uban mga facilities na ma-provide sa ato ang local government units. So far, I don't know if napabay gigamit na mga gigamit ba nagigamit na mga schools na as part of their isolation or na-identified sa local government unit as isolation. Okay, para Dr. Bersaldo is back. So hopefully, ma'am, nasagot ko yung tanong, ma'am, regarding sa school as ginagamit na facility as isolation facility po. So let's go back to Sir Dr. Bersaldo. Doc, are you back, Doc? Yes, Doctor is back. So again, Doc, I will give you again the screen, Doc. Thank you, Doc.
Okay, sorry. So I am back. I am going to continue my presentation with regards to some tips that we can use at school, no, for the upcoming opening of schools here in Davao Oriental. So one of the things that we also have to take note when it comes to when we already open our schools for our students is to observe that our classrooms must have an increased airflow and ventilation. So we open windows. Most of the time, we use air conditioning with exhaust, no, kung available siya. And then we post signages encouraging good hand and respiratory hygiene practices. So these are infomercials and what you call this, educational materials that we can use for our students to browse upon or to see when they are at school. And then we ensure that trash is removed daily and disposed of safely, no? Especially ang ato ang mga face mask and other PPEs. that we have to dispose of. So you coordinate with your menro as to the proper disposal of waste in our localities. Okay? So for parents and caregivers, these are some of the tips that we can give you when it comes to helping fight COVID-19 in the era of in education. No, so we know the latest fact. We recognize the symptoms of COVID-19 in your children. No, sila ko tong gipang-diskutan ako ganina. We keep children in school when healthy, and we keep them at home, especially when they are sick. And we help children cope with stress. No, so washing hands, and then these are some of the checklists that the teachers and our educators can give to our parents as guides for us to monitor our child's health at home. No, so we monitor our child's health and keep them home from school if they are ill. So dili sila pugsong ng eskwela gyud, maski og ipang kalentura o ipang ubo. We teach and model good hygiene practices for your children. No? All the parents. No, so we show them how to wash hands properly, especially for our preschool children and for those in the primary and elementary level. And then we ensure that safe drinking water is available at all times at homes, at our homes. And then we ensure waste is safely collected, stored, and disposed of. So we must have a separate area for infectious waste, even at home, because we consider our face mask as infectious waste. And then we practice proper cough and sneezing etiquette, even at home. Then we encourage children to ask questions and express their feelings with you, and also, of course, their teachers, no, sa atong mga parents. So in that way, our children can be also educated, especially with regards to how COVID-19 can be transmitted and how to avoid having the infection by simply observing the use of masks and physical distancing. And then we prevent stigma by constantly reminding our parents to remind their children to be considerate for one another. This one should start at home, no? And then the parent should be able to coordinate with school to receive information and ask how they can be of support to school safety efforts. So for students and children, mao ni ang ato ang angay nga isulti sa ilaha or remind sa ilaha that during these times of pandemic, it is okay to have mixed emotions with regards to some things. I think mas applicable din siya particularly sa ato ang mga high school students, no, kanang mga nasa K-12, kanang mga senior high na to. That it's okay to be confused, to be worried, to be angry, and then we can assure them that they are not alone and to talk to someone like their teachers or their parents in order for them to be educated and to be knowledgeable when it comes to COVID-19 and other cases. And then we should always emphasize on them to protect themselves and others by constantly following and always following the minimum health protocols. I just would like to take note, particularly on sharing of cups and utensils, because itang mga Filipinos, we are so fond of communal eating, no? Especially in schools, no? Ato ang mga estudyante, mag-share of food sa canteen, etc., etc. So we encourage that students should bring their own baon. So bring their own baon, including utensils, no? In order to avoid fomite transmission sa COVID-19, if in case ka naman. And then students can be also encouraged to be leaders in their communities or in their schools, and by sharing whatever they have learned about preventing diseases with their families and friends, and especially for the older students to share it with the younger ones, katong sa mga lower level. And then to model good practices such as modeling sneezing and coughing etiquettes, and of course, practicing physical distancing. And then to avoid stigmatizing or discriminating your peers, especially that bullying can be a rampant practice, no, sa ato ang mga ubang mga estudyante, especially the teenage ones, no? So we don't stigmatize them if ever they have parents who are COVID-19 cases or COVID-19 contacts, no? And then we always tell the parents, other family members, or caregivers that if you feel sick, you stay at home. So these next slides are age-specific health education strategies that we can um, help implement for preschool, the primary school, and those for the higher education ng mga estudyante nato. For preschool, we can focus on good health behaviors. Encourage nato sila to practice coughing and sneezing etiquette. So makabalo naman sila anak, maski o preschool pa sila, cover your mouth when you sneeze or when you cough. And then we can teach them to sing songs like Happy Birthday when they hand sanitize or when they wash their hands, and develop a way to track hand washing and reward for frequently or timely hand washing. So pwede na magbuhat ng mga awards sa classroom sa mga estudyante na maayo yung hand wash, o sa atong mga preschool na mga estudyante, mga pupils nga maayo mo hand wash. No? Then we can use puppets or dolls to demonstrate what we call this, following the minimum health protocol, no? Or when to report, or how to report, o sa mga behavior na halimbawa na symptoms ng pation. So pwede mo gamit yung mga dolls, no? For that, para malingaw po na ito ang mga preschool children. And then flapping their wings para na sila physical distancing, no? Kung matouch ang ilang mga kamot, then that would mean no, mali ang ilang physical distancing. Things like that. Okay? For primary school, of course, we still make sure to listen to children's concern and answer their questions. And then, as primary school children, medyo igara na sila compared to our preschool children, they can do a lot to keep themselves and others safe. So they can be older brothers and sisters to the preschool children. And then we can help them understand the basic concept of disease prevention. Mas makasabot na ni sila. And then, demonstrate why it is important to wash hands for 20 seconds with soap and water. You can demonstrate this actually by pwede mo magbutang og glitter sa ilang kamot, and then you run their hands in using water lang, and then tanawon kung pila mga glitters na bilin versus kung gamitan yun siya og soap and water. Okay? And then we have students analyze text to identify high-risk behaviors and suggest modifying behaviors. Example, you can also do role-playing with regards to this one. Pag halimbawa, ang teacher, mag-roleplay siya, na dili niya sundon ang minimum health protocols, and then matakdan siya, what are the consequences, what are the effects. No? So you can do that in your classroom. For lower secondary schools, these are older children already. So this is about addressing, pwede na taanin mo address of mga mental health concerns, no? Including preventing and addressing stigma in classrooms and in our workplaces or in educational institutions. And then students in lower secondary schools have high responsibilities na to do themselves, to make sure that they can teach other students to be safe and to protect themselves. And then organizations can be built to promote education and promoting more information sharing with the other students and the rest of the school, and then incorporate relevant health education into other subjects. No, pwede na siya na tumingong everyday reminder to them about how to keep ourselves safe. And then for upper secondary school, we make sure to listen to students' concerns, the teachers particularly, and answer their questions, because this level of mga estudyante medyo na sila, daghan na sila question. And then of course emphasizing that as older students, they have the responsibilities to be leaders, including being role models of, physical distancing, wearing masks, and others. And we focus more on their good health behaviors, and we reward them for those who practice and follow good health behaviors. And then we incorporate relevant health education into other subjects, and then including dealing with history, mga social studies about what happened with pandemics in the past, how they were able to what we call this address the situation before, and how we now as one community can be able to really limit the transmission of COVID-19 in our locality, particularly here in our province. And then we can ask students to make their own public service announcement via social media, radio, or even local TV broadcasting. But I guess here in our province, social media will work. So those basically are some of the tips that we can give you for starting off your school year come August 24, if indeed there will be a face-to-face learning that will happen by August 24. Okay, so that's it. Thank you so much, everyone.
Your time, Doc, I know you're busy po talaga, especially this day kasi may
So
meeting
I'm
pa po
open
kayo
now
sa
for some questions.
Yes, sir.
Since time check, it's already 12:15. I will be available for a few questions that we
Okay.
can discuss.
Doc, we have 3 questions. Okay lang ba, Doc? We limit the
Sure.
3 questions po. So, first question po natin, Doc, regarding ito po. Is there, klaro ba yung voice ko, Doc? Okay,
Yes, loud and clear.
Okay. So, Doc, ito po yung first question natin. Is there any provisions or intended for people who stigmatize or bully those who not limited to people who had exposure to COVID-19 positive patient? Do we have
Yes.
any guidelines po
Yes.
para sa mga tao na
We have
especially
a provincial Yes, we have a provincial ordinance for that. We have a national law against discrimination, but in the local level, we have a provincial ordinance for that. Nakalimot lang po sa provincial ordinance number, no?
Yes, sir.
I will give you the number later on. But we have an ordinance that penalizes and discriminate, particularly sa atong mga healthcare workers, for those of our confirmed cases or ilang contacts. What you're going to do is to gather evidence. So you document the evidence, you take pictures, you write a letter of complaint addressed to the provincial task force, and then we can lobby. In fact, there is Mati, I guess, na mga several episodes yung pang blotter yun ang mga na-discriminate sa ato ang mga confirmed cases, even the contacts of our mga healthcare workers. That's it.
Doc, include ba
Yes.
diri tong kuan, Doc, atong especially ka na nag-post sa Facebook So sorry po kanina po nawala po yung connection natin due to electrical problem. We experienced brownout po. But regarding kanina, parang ulitin ko na lang yung regarding sa question kanina, if there is a provision po ba daw sa mga nagkakalat ng informations or nagbubuli or may ginagawang misinformation po regarding sa ating mga COVID-19 cases or yung na-expose. Yes, there is, according to Dr. Bersaldo. We can refer our questions or we can refer that to MC number 8, series of 2020 sa CSC. So may provision na po tayo dyan. Ako nakita. And regarding sa katong gipangutanan ni Ma'am in support po sa if there are schools na ginagamit po daw as kining quarantine. So far wala po tayong nagamit now. Wala na po yung ginagamit na school for facility or isolation unit currently. So wala na po tayo na school na ginagamit. And again, before we officially close the activity po, we'd like to thank the 200 viewers sa YouTube live natin sa Department of Education na YouTube channel and 140 I guess sa atoang FB live sa atong official page sa Facebook. So we would like to again extend our thanks to Dr. Maria Corazon Dumlao for presenting the DepEd required health standard, to Sir Stephen Castres for presenting the required health standard inventory. We will send later po regarding the required health standard inventory na format or form. And lastly, we'd like to extend our gratitude and thanks to Dr. Reden Bersaldo for presenting the current situation of our province and the IATF and OPSEN response for COVID-19. Naputol lang po siya kanina pero again we're lucky na natapos na before naputol po yung presentation. And again to all the people po na tumulong po sa amin dito, Sir Francis ng ITO sa School and Health Nutrition Division led by Dr. Pineda. with Ma'am Charis Torpio po and your host, Mac Aidan Novicobero of the Division of the Armed Services. We would like to thank everyone for listening and for coming and joining us here. So in behalf of our SGOD Chief, OIC SGOD Chief, Sir Ernesto Cabanes, and our School Division Superintendent Reynaldo Melurida. We would like to thank everyone to our part of this activity, to our for our mga speakers and everyone who are in the field na naging part po ng ating activity, for one-day activity. Daghang salamat og again, regarding sa attendance, kindly check the link and we will present to you and regarding sa ato ang DepEd na required standard, we will send it to you later po, the DO regarding that. Again, daghang salamat ug maayong buntag sa tanan.
Thank you.
Na-record pa to, sir?
Thank you.